Hey everyone, welcome to a new episode of the Excellence in Healthcare podcast. And I'm excited about our guest today. We have Mr. Jeff Taylor, CEO of MedCura Health, based right here in Atlanta, Georgia. Jeff, how are you doing today, sir?
I'm doing great. How are you?
I'm doing great, doing great. And I was just joking, just for the audience's sake. We had the chance, Jeff. I just want to give you kind of a quick history. Um, I connected with you surprisingly a few years ago on LinkedIn.
I saw
And
that.
then it wasn't until at one of our Chamber of Commerce events here when you were collaborating with, I'm sure, a shared colleague, Sharice Braxton. And I asked Sharice, I was like, who's that guy? And she told me who you were. So that's how you kind of popped up on my radar. But I think you may have probably been getting messages from me and my automated email series. But Jeff,
I think
then we
so.
we just connected, what, about a week or so ago in the gym
Right.
out of all places. And I was just like, let me shoot my shot. I really wanted to invite you to be a part of this conversation. So I just want to say thank you for saying yes.
Oh, absolutely. It's my pleasure.
Absolutely. Well, Jeff, let's get into it, man. I would love to just start with a quick introduction. Would love for you to give us the overview on yourself and the role in MedCura as well.
Excellent. I've been serving here as the MedCura Health CEO since 2005. We rebranded in 2019 from Oakhurst Medical Centers to MedCura Health. So many people in the community are still making that transition. But we adopted that name because we wanted to be more customer service focused. And I'll talk about that probably in some of the comments later on. But MedCura means medicine with care. It's been exciting serving here as the CEO and serving the community, doing our best to help those who are underserved in healthcare. We provide a number of specialty services, OBGYN, pediatrics, and another additional OB specialty services so that we can serve the community and lead them to exceptional health.
All right. No, thank you for that overview. And I would still love to dive a little bit deeper, maybe into your specific journey, Jeff. I'm going to say again, going by your LinkedIn page doesn't say anything about Medicare. So I'm going to talk to your publicist and tell her we got to freshen it up for you. But please tell us the journey. How did you go from your background in finance and as a CPA into leading a great organization with Medicare?
I started my career at Deloitte. Back then it was called Deloitte and Touche. So it goes a long ways back. And then I obtained my CPA license working there. Worked with a number of organizations as a controller. And then in 2000 made the switch over to healthcare. So my previous experience prior to 2000 was primarily in manufacturing. But I came across someone who was looking for a CFO in healthcare. So I began at Southside Medical Center in the year 2000, served as their CFO for about 5 years, and then came over to MedCura Health in 2005. So it's been an interesting transition. You kind of never know where you're going to end up sometimes in your career. And in reference to my LinkedIn page, I probably talk more about my services as a CPA in helping people with their taxes and help resolving their issues with the IRS. But primarily, I'm in the healthcare space.
Right. No, it's fantastic. And I'm just jabbing at you about your LinkedIn.
No problem.
I would love to get some insights. I mean, especially making that transition from, manufacturing, but now legitimately, I mean, you're healthcare 20 plus years now. What are some of your leadership principles that you lead with today? What does that start to look like on how, you're guiding your team and leading your team over at Medcura?
Yeah, three things. One is to be forward thinking, understanding what's happening in the industry, and understanding how it applies to your organization. I think good communication is really important. I've learned a lot. I try to learn from things that don't necessarily go right in communication, listening to the staff, and um, and so I think we've prioritized having good communication throughout the organization. I probably have switched over to the flip side where I may be over communicating sometimes because I'm trying to think of, okay, when we're going to do a new initiative, How do I bring as many people in the conversation so nobody says they didn't know about it? But I think communication is an important principle. And then also understanding the difference between having data and anecdotal data. So sometimes you have individuals that say this is happening. And I've learned to ask the question, well, how many times is that happening? Do you think we can find data to support that? So those are three things I think are important in my leadership: forward thinking, communication, and having data to be able to support decision making and to resolve differences.
All right, fantastic. It sounds like that's the CPA coming back out with the data
Oh,
point.
yeah.
It's like, but verify.
Yeah.
Um, Jeff, I would love if you could share it. And again, just maybe for the benefit of our audience, Jeff, I've been on a roll over the last couple of episodes in our podcast here with wanting to highlight leaders like yourself who are leading community health centers, rural locations, critical access locations. And so this is an important conversation that I really want to make sure our audience can follow because so much of healthcare, you only hear about what I just like to call the bigs. We're both here in Atlanta, so it's the big Wellstars, the big Emory's, where the reality is organizations like yours are taking care of millions of people every single year. So I guess with that setup for our audience to kind of plug into our conversation, I would love to just ask, what are some of the challenges that your organization may have come, kind of fight through on a yearly basis or even current? But then more importantly, what are some of the solutions? How are you all solving those problems and bringing, strategies and innovations to the forefront?
So, as a community health center, there are about 1,500 community health centers across the nation, and we provide healthcare services mostly for the underserved. So, we have a lot of uninsured patients. And I think the big thing to keep in mind is if someone doesn't know where to go to get healthcare, a lot of times they'll go straight to the emergency.
Correct.
Well, we offer an alternative where people can come to us and not only because, well, let me back up here. Sometimes if you talk to hospitals, they'll tell you that over 50% of the patients that come to to the emergency room could have been treated in a primary care setting, which we are that primary care setting. And so we offer an opportunity for them to come to us, not just for that one problem that they're having, not just their chief complaint, but to get overall healthcare services. Because when they come to us, we're going to look at their if they have hypertension, if they have diabetes, if they're overweight, they're trying to improve on their overall lifestyle from a healthcare perspective. So we're going to take care of that as opposed to just dealing with that one item that will be dealt with in the emergency room. I think one of the big things that we've had challenges with over the years is staffing. And that's something I think has been quite common in healthcare,
Yeah.
trying to find qualified staff to deliver quality healthcare services, um, and customer service. Sometimes the big thing when you go to a healthcare environment, you're not feeling well. Okay, it's not like you're going to a place of entertainment where it's going to be something that's going to be happy and joyful. So how do we provide great customer service to people that are coming to us? And so one of the things we've done is we've looked to improve our customer service, and we provide in-house training by, first of all, making it a topic of discussion at every meeting we have. So every meeting we have, customer service is at the top of the agenda. You can spend 10 seconds or 10 minutes on it. It doesn't matter. And then measuring it. How do we measure our customer service? Well, of course, we have surveys that we send to our patients to get an understanding of how their visit went, and then sharing the results of those surveys, being very transparent with our staff members and saying, okay, here are the industry benchmarks, and here's how we compare to those industry benchmarks. And then I'm looking for ways to continue to improve our customer service by, again, discussing it, looking at good examples, looking at bad examples of customer service. The bad things, we're not going to duplicate those. We're not going to mimic those. The good things, we are going to mimic those in our organization. I always ask our staff, I said, who has better customer service? And I'm thinking of a couple of fast food joints. Maybe I shouldn't mention them on this podcast, but the answer I get as to the fast food places that people go The answer I get as to who provides better customer service is consistent nearly 100% of the time. So we want to be known like that. We want to be known as a place where you can receive great customer service.
All right. And I love that. Let me ask, is that also strategic? Because we do know that, word of mouth for small community health centers is so important. Is that customer service focused? Is it also strategic just for the everyday workings from a business point of view, in addition to just being the right thing to do? But I want to connect those dots as well.
But one of the things I want to do is I want to retain our patients and our customers. And anybody who runs a business knows that you're going to gain customers and you're going to lose customers. And of course, what you want to do each year is have a net gain. But a part of that net gain is to retain the customers or patients that you. And so it's very strategic from that standpoint. We believe we provide a broad range of broad range of services that can encompass the whole healthcare well-being of an individual. And so we want people to come to us and to get those services. So it is very strategic in getting new customers via word of mouth and also maintain.
Right. And would you have maybe one example? I know you mentioned just highlighting customer service at, all your meetings and things like that. Any other examples of just success strategies that you all are focused on a daily or monthly, quarterly basis with Medcure?
Yes, improving quality of services. We are in healthcare, we are beginning more and more to be measured by the quality of services that we provide. And so one thing that we've implemented and we've been doing so far a good job of, is to find more ways to introduce people to specifically dental services, as well as have more touch points with our patients. And so both of them are going extremely well. Introducing dental services, particularly with children, through just doing something as simple as a fluoride treatment or a varnish on their teeth when you're young, introduces them, and of course, more importantly, the parent, to dental services that we provide. So just looking for more touch points to provide a higher level of service, and we've seen the number of visits and patient contacts go up as a result.
All right, fantastic. I want to move you into a part of our conversation. I just call it a deep dive into excellence. And Jeff, I'd love to just ask, what's your personal definition of healthcare excellence?
Putting the patient first. Our vision here is leading people to exceptional health. So one of the best ways to do that is to put the patient first. How can we accommodate as many patients as possible? How can we make sure that they get the health care services that they need? And so if we focus on that, now, of course, there's that old saying, no margin, no mission, right? So you've got to be able to make what you do sustainable. Otherwise, you're going to be completely out of business. But I still think there's room for putting the patient first, and then looking for strategies if it's something that may hurt your margin a little bit, looking for strategies to make it so that you can reduce perhaps your expenses by being more efficient in the services you provide. One of the things we did, what I've heard from our doctors is, they've got to document so much of what they do. Everything they have to do has to be documented.
Sure.
And so what we did was we brought on artificial intelligence for scribing for the doctor. So what the doctor does is they walk into the exam room, they turn the phone or iPad on, and that will just listen to the actual visit. And then that information is taken from that recording and documented for the provider. And so what it's done is it's allowed our providers to look directly at the patient
Okay.
and converse directly with them, therefore improving the services that they provide. I've been to the doctor sometimes and they're sitting there typing on their computer and they never look up at it. And so having that face-to-face contact, I think, with the patient makes them feel as if that they are first, yet it's helping us be more efficient in our documentation. And therefore, at the end of the day, I believe we can actually see more patients and provide more services.
Well, I love that story, Jeff, and I'll share a personal story. But about a year and a half ago, while working out at the gym, I tore a ligament in my wrist, and then when I went to a provider to get it checked up on, it was recommended that I needed surgery. The surgeon that I talked to, the first one, never looked at me, to your point. She only looked at the computer and read from the computer, and, it's like I'm the computer screen now. Needless to say, I did not go with her. The second surgeon I went to only talked to me, wasn't even a computer in the room. Made a total difference. And of course, this is the person that I now trust to cut me open. So I just want to emphasize to your point that patient-centered focus that you all are leading with, but then innovative solutions like AI doing the documentation so the doctors focus on the patient. That hits home personally. Just I love hearing that.
Wonderful. You mentioned patient-centered. We are patient-centered home, PCMH, patient-centered medical home. We are certified in that. So again, it's something else that we're using to put the patient first.
Well, and that's a good takeaway just to highlight for our audience. I really want to encourage all of our listeners because it's a community of healthcare leaders and up and coming healthcare leaders. If you're not familiar with the standards for PCMH designations, go check it out. When I came into healthcare, I started at Duke Healthcare in North Carolina, and the very first project I had was around helping many of our primary care locations get certified with that. So learned a lot really quickly, but the standards that you guys have to abide by and the rigor
Mhm.
is definitely there. And before I move to my next kind of focus, I do want to give a quick shout out. I had an opportunity to work with one of your quality leaders, Brittany Fennell.
Yeah.
Maybe about 2 years ago, we were trying to get our Georgia healthcare quality group started back, and she was so impressive. So I just want to give a shout out. I mean, you guys got quality people doing great work. So.
Brittany is phenomenal.
Let me move you into the next part of our conversation, and I call it just kind of the one big thing. So just going around any lessons learned or practical advice that you could share with our audience. And then I've been over here just jotting down notes, Jeff, as you talked. I got a couple of things I want to kind of jump into just to dive into more excellence or quality improvement mindsets. But just what's kind of the one big thing that you want our audience to maybe understand about your work or even the focus for community health centers and primary care?
Yeah, well, in healthcare in general, I'll simply summarize it as keep growing through calculated risk. One of the things I learned a long time ago, a guy who I looked up to who was a CPA, he told me one time, he said, Jeff, um, take risk in business, but make sure it's calculated risk.
Calculated. Like,
Um, Again, I mentioned earlier that you've got to keep growing. I let my staff know that if you are not growing, then you're dying. And so when you are looking at growth strategies, how can I grow and minimize the risk? And so, sometimes it's more risk or higher risk, higher reward. I know that saying goes. I'm not sure that necessarily should be applied in healthcare on a regular basis. I understand that we'll have to take risk for us to expand our healthcare services, but grow through calculated risk. Don't try to grow too fast. Try to make sure that you got a backup plan in case the growth that you're looking at doesn't go quite like you thought it would. I think that's so important. That's probably one of the biggest things I've learned over time, particularly running an organization.
well, and I appreciate hearing that. I mean, just again, with some of the notes that I've already captured from everything you shared, being forward thinking, having a focus on communication or maybe even over communicating, and now all the way down to the calculated risk. So, Jeff, I have a big IOU. So just being a guest for the podcast, I owe you a copy of my book if it's okay to send that over to you. But
Sure.
I just published my first book that aligns with the entire excellence conversation we're having. And a couple of things I highlight is a healthcare business model, because that's the work that I do is really focusing on the business side of healthcare. And I have a whole framework around patient-centered care. Two tools that I do represent. It's called a customer avatar and a journey map. So I guess that's my first question is, do you all use anything specific on how you achieve your patient-centered care, like a customer avatar or a journey map or anything else that just helps you focus on your patients? And then I do have a question um, about your data focus as well.
Right. That's a great question. Never thought of it like that. So being a CPA, my love language is numbers. That's what I tell all the time. I don't tell my wife that.
Well, so I'm an engineer and my wife is a statistician. So you're talking to somebody who gets it.
Exactly, exactly. And so that's kind of the lens that I look through when I'm looking at a business proposal or something like that. Okay, what do the numbers look like? And then that guides me to making operational changes to improve the efficiency.
Mhm.
So whenever we're looking at a growth strategy, we'll run the pro formas. We'll look at, okay, what do we expect the revenue to be? When do we expect that revenue to kick in? We know the expenses are going to be there. They're going to hit month after month after month. So what does that revenue look like so we can manage that margin versus mission? So, and I think that in the context of all of that, we're thinking of the patient. We're thinking how we can best provide the services, what expenses do we need? What things on those expense line items can we be efficient in order to reach our objectives? So that may be a little bit different from what you perhaps expected, but that's the lens that I look at it through. And then certainly bring in our healthcare experts within our organization to help guide us also.
All right. No, that's the perfect lens just to add on to more tools, techniques, more, strategies and approaches to achieving that goal. And then the last really quick question, and I'll slowly start to wrap us up, Jeff. So I really appreciate the time with you. Um, from a data point of view, so what's your process for maybe keeping everybody in tune with the data, the metrics, all of the key, success indicators? Do you all have dashboards or, you know, KPIs or some form of communication you're using?
Yeah. So first, I want to say that hopefully each business owner will use some type of system that's capturing lots of data. In our business, we use electronic medical records, and so pretty much anything that we need is in there somewhere.
Nice.
That's my perspective. If it's not, then we've got to figure out how to get it in there so that we can extract the data over, a month or a year. So I think that is extremely important. And yes, we do use KPIs. We share that with the board every month when we have a board meeting. And then with our staff, we would like to highlight, the number of patients that we've seen, what our revenue growth or decline has looked like, um, and and then also just kind of sharing with them too what's happening in the industry. From a communication standpoint, Jarvis, I think that's important. Sometimes people think that their organization is the only organization in the world that has a specific problem. And I've learned that probably every organization has that problem, but it's just viewed differently and addressed differently. So we're using that data to address challenges that we have and then talk to other organizations and see if they're experiencing the same.
And I appreciate that. That's really, Jeff, a lot of the momentum that I wanted to build with this podcast. And I had an earlier version of the podcast. So this podcast has actually been around for about 5 years now.
Nice.
Yeah, the goal is to really help us as healthcare leaders, as business leaders, understand and connect the dots. Like, small community healthcare centers are having similar problems as large multi-facility healthcare
That's right.
systems, right? But the business of healthcare, I mean, how we solve the problems can still be very standard and apply no matter, the framework of the organization. Um,
Agreed.
Jeff, man, this has been phenomenal. Again, I'm over here just reflecting on the fact that I caught you in the gym working out with your son, who just for our audience had him looking like he was on the ropes for a minute. Um, Jeff, I really appreciate this time. Before I let you go, would it be okay? Do you have any preferred way if any of our audience members would like to connect with you or just reach out? I don't know if LinkedIn or any other format would be a good avenue for you.
One of the things I would try to do is to be accessible. I really, really do. And I think it's important to make time for that. They can reach, probably the best way to reach me is at jeff.taylor@medcura.org, jeff.taylor@medcura.org. And then you can always go to our website, medcura.org. to look at the services that we provide, and you'll see the members of our leadership team and all that good stuff. But yeah, I mean, any questions, comments, suggestions, you can reach me at jeff.taylor@medcura.org.
All right, fantastic. And Jeff, I just want to say thank you one final time to our audience. I hope that you all got a lot of great information and insight out of the conversation with Jeff. Everything from the model for primary care, community health centers, down to strategically, how do we keep our eyes on the prize, the numbers, watching all of the key components of the business, and communicating effectively to achieve excellence in the work that we do. For our audience, we want to encourage you all to continue to stay motivated, stay innovative, and continue to plug in with our conversations here on the Excellence in Healthcare podcast. This is Jarvis and Jeff, and we are signing off.